Good afternoon, and thank you for joining us today for another virtual media briefing about COVID-19 in London and Middlesex County. We're glad you could join us. Also happy to be joined this afternoon by the Mayor of London, Ed Holder, by the Medical Officer of Health at the Middlesex-London Health Unit, Dr. Chris Mackie, and the Medical Director at London Health Sciences Centre, Dr. Adam Dukelow. Welcome to the media who are joining us this afternoon, and a quick reminder to submit your questions using the question form here on Microsoft Teams. And if you could indicate your name, your media outlet, and who your question is directed to. And also welcome to those tuning in this afternoon on Rogers Television, as well as the Rogers Facebook page and YouTube channel, Global News Radio AM 980 CFPL, and those who are watching on the CTV London website. I do want to point out that we do have a lot of questions in the queue today, and also that we will be ending today's virtual media briefing at 2:30. So any questions that are not specifically related to COVID-19, I'm going to respectfully step around those and really keep the focus on COVID-19 this afternoon. So with that, let's begin with our opening remarks, and we'll start with Mayor Ed Holder. Mayor Holder.
Well, thank you, Dan, and good afternoon, everyone. So having spoken earlier today with our head of bylaw enforcement, I'm pleased to report it was a relatively quiet weekend despite Super Bowl Sunday, and I'm truly grateful for Londoners' participation and really being mindful of what needed to be done. So our bylaw enforcement officers partnered with the London Police last night to respond to calls regarding potentially illegal indoor gatherings. Only one was found to be at odds with existing COVID orders, and I think that's more than amazing and, again, appreciated. The host of that party in particular was charged with participating in a gathering with non-residents of the same household, at the same household. Otherwise, as mentioned, it was a very quiet weekend. The big news today, of course, is the Premier's announcement over the last hour, where he said regarding the current stay-at-home orders and when our economy will begin to reopen. Based on what Premier Ford said this afternoon, the stay-at-home order for London Middlesex will be lifted 1 week from tomorrow, that is Tuesday, February 16th. At that time, our region, along with others across Ontario, will be moved back into the original color-coded framework introduced by the government in November. Now, it's unclear to me at this time which tier London Middlesex will be placed under come next week, although right now we appear to be trending towards either the orange or the red. At this point, more orange. Regardless of where we wind up, this is not back to normal. The Premier and the Health Minister made it crystal clear this afternoon that they will not hesitate the lockdowns and that implementation of same as necessary. We know that's how quickly it can change. Ontario is also changing the rules of retail for the so-called gray lockdown zone, allowing all retail stores, including big box stores, to open at 25% capacity and 50% for groceries. Limits for red zone are 50% for all stores and 75% for grocery stores. Now, I'm extremely encouraged to see that these changes have occurred, as to me it corrects an unlevel playing field, which to this point has given big box stores a significant advantage over many locally run businesses. Ultimately, today's announcement, I believe, is a reason for optimism. But as we've seen before, things can change so quickly, especially when we don't follow the public health guidelines. Absolutely critical that we do that in the coming weeks if we want to keep each other and our economy vibrant, healthy, and recovered. With that, over to you, Dr. Mackie, please.
Thanks very much, Mr. Mayor. It has been a very good sign to continue to see cases trending down. That's obviously what we all hope for. We're now at the point where our numbers are low enough that there's a lot of fluctuation day to day based on outbreaks that are where we're testing large numbers of people, which is probably accounting for about a third of the cases over the last 3 or 4 days. And so we really need to keep our eye on that 7-day moving average, and that does continue to move down, which is great. Very much in parallel, but slightly lower than the provincial average per capita. The other reassuring thing is we're seeing a downtrend in deaths as well. And that's no doubt in part due to the vaccine campaign's success in long-term care and high-risk retirement homes. We are about halfway through by the end of today through long-term care and high-risk retirement homes, second doses for all residents. That's really where the vaccine campaign is focused right now, second doses for residents of long-term care and high risk. We also did see the Agriplex reopen today, very exciting. I'm sure Dr. Dukelow will be able to update us a bit more, but having that resource on hand to offer second doses for those healthcare workers in those high-risk settings that have received their first doses earlier is really a positive as well. And Dan, I'll leave it at that. I'm sure there'll be lots of great questions. But before we take those, over to Dr. Dukelow.
Thank you very much, Dr. Mackie and Mayor Holder, as well as Dan. And thank you again to our media partners for taking the time to attend today's briefing. I think it's a great opportunity for us as healthcare providers and public health and politicians to get to chat with you. I'm sure there's many questions for Dr. Mackie around Premier Ford's recent announcements, so I'll keep my messages brief about the situation in London Health Sciences Centre today. Pleased to report that we continue to have no active outbreaks of COVID-19 in our facilities. As you know, late last week, we were able to declare, in partnership with the health unit, declare the outbreak at UH Emerge over, and we continue to have no outbreaks. I'd like to thank Dr. Mackie and his team at the health unit for their assistance throughout the pandemic, but especially in the past few months as we battled through to contain and eventually resolve all of the outbreaks we were experiencing. We currently have 22 inpatients that are COVID-19 positive, of which 8 are in critical care. While our overall occupancy has been stable, hospitals and other areas continue to experience intense pressures on the resources. LHC continues to work with partners from across the province to ensure capacity is appropriately balanced throughout our healthcare system, particularly in critical care, which is facing significant pressure in the Greater Toronto Area and Waterloo-Wellington. Hopefully my update today provides a sense of optimism. However, it is critically important for everyone to continue to follow the public health guidelines to limit the spread of COVID-19. Our numbers of patients we admitted over the weekend with COVID-19 continue to be in the double digits, but the total remains stable as we're able to successfully discharge people. The pandemic is not over, and the remaining possibility of future outbreaks. We must continue to do whatever we can to limit the spread of COVID-19. Thank you for your time and look forward to the questions.
Thank you, Dr. Dukelow, Dr. Mackie, and Mayor Holder. Well, we do have a lot of questions, so let's get to them right away. The first question comes this afternoon from Steve Young at CTV and News Talk 1290 CJBK. Dr. Mackie, this one is for you. What are your expectations as far as what reopening will look like in Middlesex-London once the emergency order has been lifted? So again, a bit about the Premier's announcement earlier this afternoon.
Yeah, thanks for the question. We don't have a tremendous amount of detail as to what will be happening in London next week. What we do know is that the stay-at-home order will be lifted and that the Middlesex-London region will be moved back into the color-coded framework. As the mayor indicated, we're likely headed to orange or red, depending on how case counts are looking. I did speak with the Chief Medical Officer of Health at lunch today, and we will speak again later in the week regarding where the community is moving to, and hopefully we can continue to see cases trend downward.
Thank you, Dr. Mackie. The next question is going to come from Jennifer Beeman. And Jen asked Dr. Mackie, is the province consulting with the Middlesex-London Health Unit on the restriction level we will be returning to?
Yes, thanks for the question, Jen. We expect to have a conversation with the Chief Medical Officer of Health about the color-coded system and where this region would return to next week. The decision on that is a decision of cabinet, so it's really about what the data is looking like. At the end of the day, the cabinet will decide what level the Middlesex-London Health Unit will move into.
Thank you, Dr. Mackie. The next question is for Dr. Dukelow. Actually, Jen Beeman has two for you, Dr. Dukelow. First, has London Health Sciences Centre taken in any additional out-of-town COVID-19 patients? And second, how is hospital and ICU capacity at LHSC?
Thanks very much, Jen, and thank you, Dan. We did take in one additional critical care patient middle of last week, I believe either Wednesday or Thursday, but none since that time. And our hospital capacity remains stable and in good shape due to a lot of the efforts within the walls of our hospital, but also in our community to keep our counts down. I believe our occupancy in the University Hospital ICU is sitting at an overall of about 85%, and Victoria Hospital is about 75%.
Thank you, Dr. Dukelow. Dr. Mackie, I think this question is more for you, and it's a follow-up from Jen Beeman. The second doses of the COVID-19 vaccines are underway at the Agriplex once again today, and also in long-term care homes. When will the health unit have enough supply to administer first doses to new people?
Excellent question. Of course, that's what we're all looking to understand in terms of the vaccine campaign. That is question number one right now. When will we be able to offer new first doses, and to whom? I understand that on the latter question, there will be guidance coming out from the province soon, so we're looking forward to that. On the question of timing of doses, we have been indicated that we will continue to receive doses each week over the next few weeks. We're hopeful that the doses we receive will be even higher than the past, which would allow us to accelerate into the level of providing new first doses to new individuals. But as you are well aware, the supply chains are something we're all learning about daily, and often learning different and conflicting information in the same day. So while we do have commitment of vaccines from the province over the next few weeks, we don't know exactly how many and exactly which days, and all commitments come with an asterisk that they are tentative and subject to being updated based on federal procurement.
Thank you, Dr. Mackie. Let's go to our next question. This one comes from Andrew Graham, who is with Global News Radio, AM 980 CFPL. Dr. Mackie, this one is also for you. Can you provide a refresher on how COVID-19 variants are tested for in local cases?
Yeah, so at the moment, the testing for variants of concern, so this would be the South African variant, UK variant, Brazilian variant, which all share some similar characteristics, and in particular seem to have the ability to spread more easily. That testing is done at the provincial level. Public Health Ontario, along with a number of research labs which are partnering on that testing. We don't have yet universal testing for all COVID samples for the variants of concern, but that is the direction that the province is moving. So we did get a study last week that reported on some prevalence testing, so some random test sampling of COVID results that came out, I believe, Thursday of last week. And it showed that across the province, around 5.5% were testing positive for variants of concern, but those were primarily in outbreak settings. So in the general community, it was a much lower percentage. And all of that to say that as we move towards broader testing of all COVID samples, we'll have a much better understanding of how many of the variants of concern and how much of a factor that is playing in our current pandemic.
Thank you very much, Dr. Mackie. Let's go to another question. This one comes to us from McKinley Leonard Scott at the Middlesex Banner. Dr. Mackie, McKinley is curious as to what needs to happen at the Mount Bridges vaccination site to prepare it for use. Retrofits, refrigerator installation, additional storage space, security measures, etc. Also, for what length of time will the Caradoc Community Center house the vaccination site?
Yeah, you said it, McKinley. All of those and more. There is retrofitting happening. There's establishment of storage space, security measures, refrigeration installation. We also have an ultra cold freezer that is available for that site, although we have some technical limitations. It's not easy to transport the vaccine once it is received we'd have to produce our own dry ice. We don't have that capacity at the moment. So likely we'll be taking the frozen vaccine to the Mount Bridges site, and it thaws while it's there. It's kept in fridges for a number of days. That's all. Those are all details where we're ironing out. The big additional piece of work that needs to be done over the next few days and weeks is to make sure that we have backup generation at that site, because you really can't risk having the fridges or freezers go offline for any period of time. So that is all happening over the next week or two, so that we can be prepared if and when we have adequate vaccine supplies to use that site. Of course, there's also the issue of staffing up. It's a new site. It will be ideally a high volume flow through site. And so, bringing on vaccinators, supervisors, managers, et cetera, to make sure that the complex logistics of that campaign are as smooth as possible at the site. I think it's important to clarify that we're still in a place where we don't have vaccine available to the general public. So, I know Strathroy Hospital and Middlesex Health Hospital Alliance have received a flood of calls for people who were trying to book their appointments. Unfortunately, that's not available at this point due to vaccine supply. We're still focused on getting second doses to those who've had a first dose in order to make sure that their immunity is adequately protected and doesn't wane before they receive their second dose.
Thank you very much. Let's go to a question from Colin Butler at CBC London. And Dr. Mackie, I think this picks up on exactly what you were talking about. Here's what Colin asks. Dr. Mackie, how much of a priority should we give grocery store workers for the COVID-19 shot in order to protect the public?
Yeah, I appreciate the question, Colin. We are not going to give direction in terms of prioritizing one group against another. Our role at the local level will be to inform the province to make sure that they have good information on what's happening on the ground so they can make that decision. As you can imagine, everyone wants to be first in line. Everyone deserves, frankly, to be first in line. And the vaccine is in scarce supply. So it's got to be rationed in a way that will protect from mortality as much as possible. The biggest issue is trying to balance between giving the vaccine directly to those who are at highest risk of death, and on the other hand, giving the vaccine to those who are exposed to or potentially could communicate the virus to those who are at the highest risk of death. And as you can imagine, that's a lot of sets of difficult decisions.
Thank you, Dr. Mackie. And a follow-up question from Colin. Should people keep their time at the grocery store to a minimum to protect themselves from the virus?
Appreciate the question, Colin. Appreciate the question, Colin. I think the thing that we need to do is keep all contact with others to a minimum right now. We're still under a stay-at-home order until at least next Tuesday. And even when that order is lifted, we would highly recommend that people act as if it are still in place in terms of minimizing any time that they spend with others in any setting. Of course, outdoors with masks is always safer. The risk of spread in a grocery store, you have seen cases. You may be referencing, Colin, the Simcoe Muskoka health unit cases where there were people that tested positive after spending a fairly limited amount of time in grocery stores. That isn't something we've seen broadly with this pandemic. Certainly, we have not seen that here in Middlesex and London or in other Ontario jurisdictions. The primary, risk in grocery stores is staff spreading the illness to other staff, particularly on breaks when people might be, in closer proximity or potentially taking fewer precautions.
Thank you, Dr. Mackie. We are getting down to the end of our questions, so we do have a little bit more time. If you have been waiting for a moment to submit a question, now would be a good time. If you've got one more or two more, we might have time for. So there you go. You have been warned. Next question goes to Dr. Dukelow. Dr. Dukelow, this one is from Jennifer Beeman. And this looks like just a clarification to an earlier question. How many out-of-town critical care COVID-19 patients have been transferred to LHSC to date?
Thanks very much, Jen. So we are constantly receiving out-of-town patients under normal business as a regional center, but specifically related to the critical care command center's work to load level capacity across the province, we've received 4 to date, but that does not include trauma, other types of things that we're the regional center for.
All right, thank you very much, Dr. Dukelow. Well, gentlemen, that does bring us to the end of our questions for this Monday afternoon. We want to thank you for joining us, for making the time to learn more about COVID-19 in London and Middlesex County. We will be back with our next virtual media briefing on Thursday afternoon at 2 o'clock. So between now and then, enjoy the next few days, and we'll see you on Thursday afternoon. So long for now.